How's it? This is Joel Agrivi, founder CEO of Paubox. We're here at Uno Dos Tacos, South of Market, San Francisco. It's JPM Week 2018. We're with our friend Niko Skievaski, and we're going to ask a question during JPM Week. Niko, what's the biggest concern for digital health in 2018, in your opinion?
Good question. I think the biggest challenge that we have this year and the biggest risk is that these technologies don't actually get adopted by the health systems they were meant for.
What I'm concerned about is that a lot of the tools that you see are developed for the consumer, but with the provider or the payer in mind.
I think 2018, the biggest concern everybody need to pay attention to securing everything. Our communication need to be secure, our access need to be secure.
So my biggest concern for health in 2018 is to be too US focused. We need to look beyond the US significantly for both healthcare concerns because they affect the US, as well as looking for new solutions for healthcare outside of the US.
My biggest concern is that in the past couple of years, there's been this big move towards value-based care, and a lot of talk about trying to make a difference in terms of the actual outcomes for patients, and basically that hasn't actually translated into business. My fear is there's gonna be a lot of still the talk, but then fewer and fewer of these new players getting a chance in healthcare, really being able to make a difference.
What you're seeing is that health systems are understanding that they can't just bring in solutions that haven't gone through a clinical trial and prove that they either improve patient outcomes or reduce the cost for health systems, and we're seeing a definite change.
My biggest concern for digital health is accessibility to information. For me, it's like, how do we get this into the hands of the patient as quickly as possible, and not just have that intermediary of the doctor looking at information, interpreting for you, and having to wait.
My concern is that with all that's changing on the political scene, the ACA going away and all the political battles over the ACA, I think it's actually going to give a lot of opportunity for us to realize how important it is to make sure that everybody is insured.
For concern, I think I'm concerned about our ability to keep the United States as a leader in healthcare and about the quality of outcomes for healthcare.
I'm a little bit concerned that we still have a lot of administrative waste in our industry, and we lose a lot of money to it, about 190 billion each year, which is crazy, and we still lack practical and tactical solutions to address that.
My biggest concern is interoperability. That's, I think, one of the biggest concerns of American healthcare in general.
My biggest hope for digital health in 2018 is that the replatforming of the old world EMR space will reach a tipping point. And there will be a blossoming of companies like yours that build new apps on top of old world data.